Senator Latz.
Mr. President, I move that further proceedings under the roll call be dispensed with and the sergeant be instructed to bring in the absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Members, as usual, if you'd be so kind as to stand. Today's chaplain is Reverend Dr. Dwayne Davis from Plymouth Congregational Church in Minneapolis. And following the prayer, please remain standing for the Pledge of Allegiance. And today's a good day for us to do prayer and pray for our system as well.
Mighty and everlasting God, creator of humanity in all its beauty, diversity, and sacredness, thank you for loving, embracing, and ordaining us as your beloved, just as we are. Thank you for inspiring us to pursue honorable vocations in public service. In our humble service, may we not succumb to rigid and merciless assertions of power in exercising our duties, but rather be motivated by humble service alone in the public interest. Help us forge a path of peace, liberation, and justice in the wake of polarization, nationalism, and radicalism, assuming our roles as repairers of the breach and restorers of communities. Kindle within us a desire for justice that surpasses all the differences that divide us, so that we may undertake our work with respect and understanding. Inspire us to do the people's work with hopefulness, graciousness, and neighborliness, aspiring to move us toward a greater common purpose. May the fullness of grace surround us always, blessing our going out into the world with good news. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, members. The secretary will take the roll.
Abler, Anderson, Barr, Bolden, Carlson, Champion, Coleman, Swadzinski, Dames, Dibble, Dornick, Draheim, Drazkowski, Duckworth, Diedzik, Eichhorn, Farnsworth, Fateh, Frentz, Green, Grunhagen, Gustafson, Hochschild, Herr, Hoffman, Housley, Howe, Jasinski, Johnson, Klein, Coran, Kroon, Kunish, Kupek, Lang, Latz, Liskey, Limmer, Lucero, Mann, Marty, Matthews, Mayquaid, McEwen, Miller, Mitchell, Mohammed, Morrison, Murphy, Nelson, Humuver Baton, Pappas, Pa, Port, Pratt, Putnam, Rarick, Rasmussen, Rest, Seeberger, Utke, Weber, Wiesenberg, Westland, Westrom, Wiklund, Zhang.
Members, pursuant to Rule 14.1, the following members intend to vote under Rule 40.7. Barr, Herr, and Mann. Members, a quorum is present. Members, as usual, if you want to follow along, I'm looking at the Senate agenda. It is dated Monday, May 22nd, 2023. Members, we will begin at the 8th order of business, introduction and first reading of Senate bills. The bills listed on today's introduction calendar are given their first reading and referred as indicated. We'll now proceed to the 9th order of business, motions and resolutions. There's an author's motion to read at the desk. The secretary will read the motion.
Senator Abler moves that his name be stricken as chief author, shown as co-author, and the name of Senator Matthews be shown as chief author to Senate file number 3353.
Members, we will adopt the motion. All in favor say aye. All those opposed say no. The motion prevails. Senator Abler is not here? All right, members, remaining under the order of business of motions and resolutions, we will now go to Senator Wiklund for the HHS Conference Committee report. Senator Wiklund.
Thank you, Mr. President. I move that the foregoing recommendations and conference committee report on Senate File 2995 be now adopted, and that the bill be repassed as amended by the conference committee. And I request a roll call.
Roll call requested, roll call granted. Senator Wiklund, to your motion.
Thank you, Mr. President. Today we're hearing the conference committee report on Senate File 2995, which is the HHS Omnibus bill. This bill is a large bill in terms of number of pages. It's also large in terms of the impact it's going to have on Minnesotans all across the state. The bill, as you recall, it does have two targets within this bill. One, it relates to children and families, and the other is called the HHS target. The bill targets that we adopted, and we met those targets for those areas. Just to go through some of the highlights of the bill, in terms of the children and families area, this bill is a transformational approach to helping our families with support during their earliest years of life of their children, and helping the early childhood workforce. There is a provision in this bill for Child Care Assistance Program maximum rate update. We are now going to increase the rate paid to child care providers under the CCAP program to the 75th percentile, which is something we've been trying to work towards over the past probably 10, 12 years, trying to get back to this level. At this level, it means that families could afford 3 out of 4 child care providers in their area. This will be a game changer for families looking for child care providers who will accept CCAP payments. It's also a game changer for providers themselves to be reimbursed at closer to their necessary rates to continue their services. This helps family child care providers. It helps center providers as well. Another extraordinary provision in this bill is the continuation of a compensation support payments, the Great Start compensation support payments. This program will continue our efforts over the past couple of years to provide monthly retention payments to eligible child care providers, and the program will allow us to increase compensation and benefits for early educators working in eligible programs, and it will help us move towards a livable wage for this workforce. The average child care worker in Minnesota, the wages are only around $13 an hour. This bill won't be enough to make all the changes we need to support child care providers, but it will be transformational, and we will see the benefits of beginning to invest significantly in the early childhood and child care system. This bill also, to help with families and children, it sets up a Department of Children, Youth, and Families. This will help families be able to be better coordinated with programs. It will look at our systems in terms of the family and how best to serve their needs. So this bill will fund and establish that department. Other children and families areas that I think are stand out in this bill are funding for programs that support our need to address homelessness in Minnesota. It provides additional funding for such existing programs as emergency services for homeless people, the Homeless Youth Act. We are able to essentially triple what our state investment is in the Homeless Youth Act, which will help many more young people in our state who are facing homelessness. It also has $100 million in capital for emergency services shelter capital program. This program will allow us to not only provide services to shelters, but to provide capital for building and remodeling shelters. It will help existing eligible organizations and new ones improve the quality of existing shelters. and make available other emergency housing. It will meet operating and maintenance costs of shelters and provide essential services to homeless persons. In addition, we are taking action to reform the AMFIP program, and we will be repealing the diversionary work program. Cash programs in Minnesota have antiquated procedural requirements that are not uniform with other public assistance programs. This provision will simplify and modernize the reporting requirements, align budgeting methods with nationwide best practices, encourage earned income and employment, and create equity across the program. We are also investing in other smaller grant programs that will be assisting children and families, as well as child care workforce programs. We are providing funding to go towards retain grants, which will help child care providers who are seeking additional education. There is funding for an early childhood registered apprenticeship program. This program will begin piloting this summer, and I'm excited to see how we can better encourage more people to go into the child care field. There's also funding for the shared services program, which helps family child care providers access business supports and in a shared service model. There's additional funding for the one-stop shop, which is a way for family child care providers to access their needs in terms of being small business people. We recognize that they face different challenges than centers do in terms of being a provider of care to children, as well as being the bookkeeper, the maintainer of their facility. And we are recognizing that they can benefit from additional programs that can help them with these business needs. Looking at the Health and Human Services part of the bill, key provisions in that area are adding continuous eligibility for children from 0 to 6. When a child is eligible for medical assistance, they will be continuously enrolled up to age 6. And after age 6, it's a 12-month continuous enrollment. This will help families be able to count on having access to health care and take one of the key pressures off of families who are in this income category qualifying for medical assistance. The bill also establishes Minnesota Care eligibility for undocumented Minnesotans. The bill leaving the floor had coverage and eligibility for children, and we have been able to extend and add to the funding in order to cover all adults and children. I think this is it's something I'm really proud that we're able to include in this bill. Looking at other highlights, the area of mental health, we have provided significant funding in the area of mental health. We have a rate increase for mental health services, which will provide a 3% increase for mental health providers, as well as adding an inflation factor. This results in a budget commitment of $17.6 million in the first biennium and $48.5 million in the second biennium. This will result in providers, many different types of providers, seeing a rate increase. The bill provides funding for and establishes a fee for the 988 Suicide and Crisis Lifeline. This is something that Minnesotans are beginning to count on, and we need to provide emergency crisis support, and the 988 Lifeline is the way we are doing that. There is additional funding for several different mental health grant programs, such as funding for infant and early childhood mental health consultation, There's additional funding for the school-linked behavioral health grants and significant funding for mobile crisis grants. We are building our mental health system, and these investments will help us establish or spread out and establish these programs across the state. One significant program that we did not include in our bill as it left the floor was a bill or a program that proposed by the governor that relates to Comprehensive Drug Overdose and Morbidity Prevention Act. We will be investing over $20 million in the first biennium and $20 million in the second biennium. We know that the opioid crisis is still very much with us in Minnesota, and we need to be taking action to address overdose deaths and substance use. So this is a comprehensive approach that the Department of Health has developed to work on these issues. In terms of healthcare workforce, we have many items that relate to enhancing our healthcare workforce. There's a grant for federal qualified healthcare apprenticeship program, grants in place to expand healthcare workforce, and those are related to various professions in the healthcare workforce. There is funding for clinical dental education innovation grants, as well as a pediatric primary care mental health training grant and a program established for workplace safety grants for healthcare entities. In terms of food, another area that the bill invests in is addressing food security. There is additional funding for Minnesota Food Shelf Program, capital projects for food shelf and tribal nation food program facilities, and a new innovative program to provide prepared meals for food relief programs. Members, there are many items, and I won't go through all of them. Another one I want to touch on is the public option. There is a public option provision, and it removes the most significant barrier that's been held from the last few years that has prevented us from implementing a Minnesota Care buy-in. We've lacked the necessary information to move forward on this proposal. This proposal ensures a well-informed path toward a public option in Minnesota in two essential steps. First, we will collect and model data through a cyclical process of data gathering, analysis, and continual assessment of goals, and we will use that data and information for final recommendations and an implementation plan that the legislature must act on next year. Data will be gathered through an actuarial and economic analysis conducted by a third party, and will assess what the costs would likely be for the state to implement the plan, estimate any impact on current federal funding that Minnesota receives, estimates impact on existing enrollees in public programs and private plans, and helps us develop a successful 1332 waiver, which is required to implement a public option. Those are some of the highlights. And I have forgotten some of the coverage highlights I should go over. We are able to reinstate the adult dental benefit. Adults on public health care programs do not have access to dental care currently, and this leads to poor oral health, and people often need to seek costly and painful care in a hospital. This bill will restore coverage for these services, meaning people can receive care in more appropriate settings, and hospitals can focus on serving other patients. There are also coverage increases for adult day treatment services, for doula services, and reproductive health care services rate increases as well. So members, I think that we have tried to create a comprehensive approach to improving health care, improving healthcare access, and improving the lives of children and families all across our state. And I look forward to discussion today and would be able to answer any questions you have. Thank you.
Senator Uckey.
Thank you, Mr. President. I move that the recommendations in Conference Committee report on Senate File 2995 be rejected and that the bill be re-referred to the Conference Committee as formally constituted for further consideration.
Member Senator Uckey moved that the recommendations and conference committee reports on Senate File 2995 be rejected and that the bill be re-referred to the conference committee as formally constituted for further consideration. Senator Uckey, to your motion to reject the conference committee report.
Thank you, Mr. President. Members, I know that we're on the last day and time, the clock is ticking, but this is an 844-page bill that the public and all of those affected by this bill never had a chance to see or weigh in on until this morning, and they still, at this point, have not had a chance to weigh in or comment. They just finally got a chance to see it. For a little history on this, there's just been no transparency or public testimony, and I think that, not that things are going to change, but I think they need to be heard. They need to offer their concerns so that when we vote on this later, we're fully informed of how this is going to affect Minnesotans in all corners of the state. And I just want to go over a little bit of what's taken place. The conference committee timeline. April 28th, the conferees were named. May 3rd, the committee went over the spreadsheets and only took testimony from the commissioners. Public did not weigh in. On May 19th, the conference committee met again and went over the final spreadsheet. Yesterday, last night at 11:54 p.m., the bill was finally released to the public. And this morning there was again a conference committee meeting which members got a chance to talk, but yet we have never allowed the public, or again, those affected, our providers. This is healthcare. We've got providers that need to weigh in on this. We've got our health plans, because there's some very important pieces in here. Major changes that should have some conversation. We're looking at the eventual elimination of managed care. It moves MA and Minnesota Care to the Department of Human Services. Puts an end to reinsurance. The Healthcare Affordability Board, which we did see previously, as that board and advisory committee are now moved to be a sub-cabinet housed in the Department of Health. More bureaucracy and how many FTEs. Those are the things that we need to hear about. It's only fair to us as members to know, and the public and the providers of all sorts need to also be informed. As we look at things where we have reinsurance has been extremely important to us, we're looking at phasing that out. I think we need to hear about those conversations. MA and Minnesota Care would no longer be under the managed care, but again, administered by DHS. There's more that we need to know. Independent studies have showed us the managed care is our lowest cost provider for these services. There's been studies all around the country. In fact, 41 states currently use managed care. No one is moving away from it. It's showing its efficiency. There's some of this called a study, but yet it all moves things forward to eventually end by 26 and 27. We need to have that conversation. People at least need to be heard that are going to be part of this. And Mr. President, that's why I would ask that this go back so that at least we could have a public hearing today. I think if we give them a couple hours to at least share their concerns and their ideas, probably not going to change the bill, but we need to be informed as we move forward. So thank you, Mr. President.
Senator Klein.
Mr. President, I request a roll call on the Utke motion.
Roll call requested, roll call granted. Senator Abler.
Well, thank you, Mr. President. I thought Senator Klein was going to tell me why he liked the bill, so I asked to go after him. So, alrighty, maybe he'll save his liking the bill comments for later. So, anyway, Mr. President, this is, well, it's an amazing bill. I don't know if we've had a bigger one for human services. Perhaps, I don't know, but it's it's 844 pages. And I remember we talked a couple years ago about this giant bill. It was something Rex, we called it. This is actually kind of a billosaurus itself, Mr. President. And it's, you know, there's definitely some primitive elements to it that really should go back to conference. Some more thoughts, some more dialogue. Mr. President, one of the things that everybody says they favor about this process here is transparency and openness in government. And I think that actually everybody in this body, and even those who are going to vote for this thing later, would say that they really appreciate that the people know. Open the windows of government, let us see what's going on, have the dialogue, and we do that, Mr. President, in a couple of ways. We have, you know, we go talk to our constituents, we figure out a bill a problem we want to solve and a method to do it, and then we have a committee process to go through that, and if we don't quite agree on the committee process, then they go to a conference committee. And Mr. President, I never took a political science course, but I remember from high school, when we had our little mini civics course, they talked about that one side puts a bill in, and then the other side does. They don't agree, it goes to this conference committee, and they mentioned something that I remember Mr. Wanstrom telling me about, and that word was something about meetings. And they would actually sit down in this hypothetical world about my high school little civics class. They talked that people would sit down and would, you know, agree or disagree, whatever. They'd work out their differences, and when that got done, then they would move it, and then both bodies would have to go approve it or not. Mr. President, and they say the minority debates process and the majority debates policy, and I will get to the policy, but I don't remember a time, Mr. President, that a bill of this size, 844 pages long, both sides left about 500 pages in that range, which is pretty big anyway, where we met 2 weeks ago on Thursday, went through the spreadsheet of side-by-sides, and then pretty much the cone of silence dropped, Mr. President. And as a conferee with some seniority on the topic, a week went by, and I thought, when's there going to be a meeting? And then 12 days went by, and we finally got together 15 days later, Mr. President, to go through a spreadsheet that was announced that it was closed already. And I looked at that spreadsheet, and I had a few questions that had come out only very briefly before that meeting. And so I really didn't have a lot of time to digest it and no language to judge the merits of some of the elements about. And so I kept waiting for that was on Friday, and then thinking that, I was asking staff, do you think some of the reviser people, how's that coming, that bill? Do you think we'll be meeting on Saturday? So I kind of kept my schedule open for Saturday, and then for sure we're going to meet on Sunday. And to my surprise, Mr. President, this 844-page document was posted right around 12:30 this morning. I checked, but when I went to bed at midnight, it still hadn't been posted. I decided I'd go to bed. So I woke up at 6, and there it was sitting looking at me, 844 pages. I began to look through it. I recognized some of the topics, some I did not recognize. And my only thought, Mr. President, was thinking, this bill should be heard. And Mr. President, that hearing occurred this morning. And that hearing on 844 pages lasted 1 hour and 15 minutes. And I had a number of questions, and I had many more that I chose not to answer because it's clear that the intention of the chair, Liebling from the House, was to get done and get this thing gone. And so it's not a good way to do business, Mr. President. And, you know, you don't vote no on a bill just because you don't know what's in it, but something 844 pages and $3.5 billion Seems like that's something that should be decided by more than two people in a room, which is what this bill is. And Mr. President, I have the highest regard for Senator Wiklund. I think that she is just a marvelous legislator and attuned to the desires of, well, your caucus in particular. But she's open-minded on some things with stuff that I want to bring up. And Representative Liebling was on her side, and they sat down and conjured up this 844-page Billosaurus. And you know, sometimes, Mr. President, it's frightening if you see a big dinosaur, like a T-Rex or something. And if you were like in some of those movies where they get loose and then they eat people, and you're running away to try to hide, and they bite the top of your car off, and it's frightening. And so that's something you can see that you're afraid of. And Mr. President, sometimes you're in a dark room and you hear a T-Rex, and it turns out it's only a recording, but you're just as scared. But sometimes, Mr. President, if you don't know what's out there and you hear noises and it really isn't, you're not in a dark room with some kind of a video of the audio thing coming at you, you're afraid of what you don't know. Mr. President, we simply don't know what's in this bill. We just don't know. There's accolades I think you're going to hear from people about how this is, actually Senator Liebling said it's a great bill, and I appreciate her opinion, and Senator Wiklund went through a few of the highlights, and there's some highlights, Mr. President. But what we've seen in this year has been where the bill that left the Senate, we understood that really well. It was heard, there were a lot of hearings. I didn't agree with everything, and that's the way this place is, Mr. President. I voted for that bill, leaving the floor, because I liked a lot about it, and I knew what was in there, because Senator Wiklund thoroughly heard everything in our committee, and that was a good process, Mr. President. And Mr. Wanstrom, Demar Wanstrom, my civics teacher, would have been very pleased with Senator Wiklund, and he would have given her probably an A for the process. And so now we go into this other process, and I kept asking, and a week went by, Mr. President, and I had no news. And I heard there were some troubles, although nobody talked to me. In fact, I was carrying around a card, Mr. President, where I had kept track of all the dialogues I'd had with the people, and it looked like this. It's not a prop, Mr. President. This is a document. And on the bottom, I signed my name to this blank card attesting that nobody had talked to me at all on anything by any conferee. And that card, actually, Mr. President, was good for 15 days. No conversation. And I understand that they couldn't talk to everybody. You know, it was 34 on our side of the aisle, and Senator Utke, they could have talked to him, but he wasn't a conferee, but I was. And so in the process, Mr. Wanstrom talked to me about that I thought for sure I'd be consulted at some time. And so, Mr. President, I even went so far as to write notes to Senator Wiklund and Representative Liebling to say, I'm happy to help. Maybe we should have a hearing. And Senator Liebling did reply to me, Mr. President, to my request for a hearing. And I have to thank her for that. She texted back, so noted. So that does count as a dialogue. So, Mr. President, so I can't say I didn't have any communications, but that wasn't particularly helpful. And so time goes on, and I heard there were some troubles in the negotiations, and so I wrote a note to the governor and to the speaker and to the majority leader in the Senate offering to help, because I thought that maybe could move this along, and so we could actually, lift the cone of silence, which, Mr. President, if you like Get Smart, that is like just one of the funniest things. Like they put this little cone of silence down, and then ironically in one of the ones, the cone of silence didn't work, and Maxwell Smart was saying just a bunch of foolish things, and everybody heard him. But that didn't happen in here, Mr. President. There was no leakage from this cone of silence. In fact, there was none. And I asked a few other conferees, how they were doing, and they said, don't know. I'm not really part of the meetings either. So I have a lot of confidence in those two people. But, Mr. President, when you're spending $3.5 billion and affecting the lives of literally more than 1 million Minnesotans, it seems like it might be a good place to have a little bit of input. And so that's the process, and the students can argue on their master's papers how process should be, but I think you'd want to consider this one as they have their own particular personal Billosaurus silentis, I think we should call it. Yeah, that's good. Billosaurus silentis, as in the cone of silence. So, Mr. President, out of this process, they forgot a couple things. And so one of the benefits of bringing people into a process is you find some stuff you forget. There's going to be testimony, or there'll be people that's jumping up to talk about the wonders of childcare and the healthcare stuff. And we're going to do a bunch of councils to work on healthcare disparities. And those are all wonderful, and you can discuss, about who gets healthcare and how they're going to be open. But Mr. President, I'm going to point out two glaring things which really are going to cause harm to Minnesota that they simply forgot. And when I asked about this, the comment was, well, we're fighting budget constraints. Mr. President, there's never been a health and human services bill like this, including child care. They got to spend $3.5 billion. And by the way, taking money out of what's known as the Healthcare Access Fund to do it, to the tune of over $1.5 billion. And which, Mr. President, $1.5 billion, if people are keeping track at home, that's a lot. And that some of that money went into healthcare, and some money just went in to feed the budget. But one of the funny things about the Healthcare Access Fund, Mr. President, and I know you know this, it's a very limited fund. We put like 1.8% of the money from all the healthcare goes into this fund. And Mr. President, there was a surplus in there. And Mr. President, you know why Jesse James robbed banks? Because that's where the money was. And so the reason they took the money out of the Healthcare Access Fund, because the money was there. And I understand, Mr. President, the inability of the majority to live on $17 or $18 billion of surplus. I can't imagine the crisis they had to go through to put a budget together with that meager amount of money, which, Mr. President, by the way, is the record of any time in Minnesota's history. And I understand their inability to deal with that, and so they had to raise taxes and fees to maybe the tune of $9 billion. And I understand, Mr. President, that $26 billion was just not enough to get by on, so they had to take $1.5 billion out of this other fund, which is paid for by sick people, to buy projects in the bill. And I totally appreciate, Mr. President, that out of all that money, they couldn't find $42 million to rebase the hospitals. Now, Mr. President, what is rebasing? Rebasing is setting the rates from the past. Right now, they're working on 2018 rates. Mr. President, do you know that in 2018, things were cheaper than they are now? I don't know, maybe you think they're the same, but you knew, of course, that they're different. In fact, they've gone up a lot in the last year. Some say they've gone up 10%. Now, Mr. President, 10% is a lot of money if you're a hospital working on 2018 rates. And do you know, Mr. President, some hospitals are losing some systems are losing $1 million a day. Now, that seems like a lot of money, but if you do it for a year, that's $300 million, which is a tremendous amount of money, and some are close to going out of business across the state. And so it seems to me, if I would have been there, I would have mentioned, by the way, don't forget to give the hospitals some money, because you're going to add 40 to 80,000 new people as we add undocumented Minnesotans into healthcare, which in the opinion of many is a great idea, and you want to think it through if it's that good of an idea or not. But so in the opinion of the two conferees who were deciding everything, they thought this is a great idea. The Senate, Mr. President, was a bit more restrained. They just did children. And you can understand that helping children and, want them to get on a good start, help their various, ear infections and all that. And there's some sympathy for that. But when they got to the conference, they decided to cover everybody. Now, perhaps that's a good idea, and we might be discussing that later. But, Mr. President, in the financing of hospitals, there's a couple different rates that get paid. One is cash. And if you have cash, actually they're allowed to charge only the amount of the highest of the commonly charged commercial insurance policy. So you maybe pay 70% of whatever the retail price is. Auto insurance pays 100%. Right, Senator Hutke? Anyway, so that's really the cash cow. If you have a car accident, they can make some money there. But then you have Medicare, which pays in the 60% range or something, and then you have medical assistance in Minnesota Care, which pay in the range of 40%. And so, Mr. President, if you have costs that are in the range of 60%, and you get 40 to 80,000 new people into your systems that want to get a lot of care because they haven't had much care, as some would say, we had testimony, and it's compelling, Mr. President, the challenges they face. So now we're asking these hospitals, some of who are already losing $1 million a day for the system, to add those in and not give them any more money. And Mr. President, that just totally confounds me. We talked in the last couple of days about nursing homes, which the governor decided didn't need any money. And so on our side of the aisle, we said they need money. They're closing. They're in desperate straits. And so we made a big deal out of it. We argued about it, and the view of the administration was nothing to see here. And finally, push came to shove, and they rolled over to give us $300 million for nursing homes. And because of that money, Mr. President, 30 nursing homes are not going to close, the ones that they weren't even worried about. So the same administration, the same governor who is so happy to add in 40 to 80,000 new people into the system and programs that are losing up to $1 million a day, decided that we should not put any money in. And so, Mr. President, in the conference committee, I had an idea. There's $22 million of unallocated money in the bill for some future study of a public option. And so I thought, since they clearly forgot this, let's just have a motion to move that money into the hospitals. And that was, well, actually, I kind of irritated the chair with that motion. But I know she cares about hospitals and the integrity of the healthcare system, and so we voted, and unfortunately, there were 2 yeses and 8 noes on that motion. And sadly, Mr. President, another party line vote to not care about hospitals. And I don't understand, Mr. President, what it is that hospitals have done to aggravate the governor about him not wanting to pay for it out of a $3.5 billion bill with $26 billion to spend, and many of whom are truly on the ropes for all kinds of reasons. So that's disappointing. And just one thing else I'll mention that I would have brought up to do, and that's the mental health care, Mr. President. I think if you asked any one of us and people on the street, is mental health care important? Well, they would say certainly yes. It's very important to have mental health care, and we need people to go to their providers, counselors, psychologists, licensed professional clinical counselors, and the rest to get their care. Well, Mr. President, I don't know if you know, but the people who are on the low end of the economic scale have to use Minnesota Care and Medical Assistance to go to their doctors. And we were so proud when we did the Obamacare expansion that we covered all kinds of people in the Minnesota Care and Medical Assistance programs, and that was a big win. Well, Mr. President, unfortunately, those mental health providers can't afford to work at the prices we pay. And so there was a proposal which the Senate adopted part of to give them a 35% rate increase, which would not make them wealthy, but at least would make them break even on their time. And with the budget constraints that Senator Wiklund had, I want to commend her. Again, another B+ on this one, Mr. President, for sending over an 18% rate increase to conference. And so, but the final result, Mr. President, was 3%. And I don't know what 3% even means. And, you know, there's some substance use providers who are trying to help people kick the habit and help people not die from being in substance use. And it was decided that they didn't need any increase because they're fine. And, Mr. President, if you want to go talk to the substance use providers and the medical assistance providers in the mental health side, they will tell you that they are committed to their service. They are passionate. They really care. But in $3.5 billion on a $26 billion budget, they didn't get anything. And so I just want to ask you, Mr. President and members, why I'm encouraging you to send this thing back. I have one more reason, so don't jump up yet, Mr. President. And this is going to be a shorter on this topic than you might have thought I would do on the last topic. Out of $26 billion, all of us in this chamber are committed to people's mental health, and we're committed to their substance use. We don't want anybody else to commit suicide. We talked about suicide a lot on the floor, that people should get care, and for various reasons why people may be suicidal. There's an article in the paper yesterday about farmers who were suicidal. And it's just tough times. And so we've decided as a state for people who are low income on Minnesota Care and Medical Assistance that we're going to make it possible to go to the doctor of their choice. Only it's hard to find one that they can go to. And so this would not be a problem. There's actually extra money in the bill, and there are a couple things that could be easily jiggered around. It wouldn't take long. It would not kill the bill, Mr. President. This could be tackled in just no time, and I assure you, I would encourage my contemporaries on this side of the aisle to say nothing when it came back if we can get these two things fixed. And finally, Mr. President, something that I was praying would not happen, that we'd have enough discussion about already on the floor, and that's the wonderful topic of abortion. Now, I don't know, we've covered a lot. We've spent days on the floor talking about this in various ways. We're an abortion sanctuary. We can have abortion from conception all the way up to like the day before birth by a 14-year-old with no parental consent. Got it. Because they ran on Roe versus Wade needed to be protected, and across the country, they're changing all the laws. And I got it. I listened, and that got accomplished, Mr. President. On the list of accomplishments is that thing on almost every list that your side's putting out. And so I thought, well, that's pretty good. I mean, at the doors, I heard about this. Problem solved, at least by one side's resolution. And doctors can do it, and they can have a sanctuary and all that, and like, fine if that's what you all want, and I didn't agree with that either. But I understand, Mr. President, elections matter, and like that topic was thoroughly covered. But in this bill, Mr. President, are probably 15 things from Senate File 70 and House File 91 that I thought were quietly put to rest. In fact, I heard members of this body, Mr. President, saying they're not going to vote for Senate File 70. There's things in here that we're going to talk more about, I suppose, including born alive. So a baby is born after an abortion, they're alive, that they have to be given significant care and records kept about the status of this 23, maybe 24-week-old born alive infant who is now deemed to be a person. Mr. President, this bill decides to repeal that and replaces it with a woefully inadequate, very dangerous paragraph, which I think will come up later. It is not the same. And this also repeals positive alternatives. Now, Mr. President, we can argue about abortion, and I'm not going to relitigate it much past this single topic because I can spend the rest of the day on this because I'm pretty upset about this even having to be here. I just don't know why it has to be in this bill at all. I could have voted for this bill, Mr. President, even with all the things that I didn't like about it, and even forgetting covering the hospitals and the other mental health providers. But why do we have to keep this topic coming up? Why? The people at the doors, if you would have asked them, for all the people that were on the side of we need to fix Roe versus Wade, so do you think when a baby is born alive, we should take away the protections from that baby to be properly cared for? Do you think that's something they would go like, what, really? No, I just think that somebody should have the opportunity to have an abortion, maybe after are surprised and for maybe the first trimester for sure, and maybe a little longer. That's what the Netherlands says, Mr. President. But in here, and I'm not going to itemize many of these, I could really go on a long time, and I'm not being dilatory, but I'm just being really frustrated, and I'm being very open with you, Mr. President, with my sincere disappointment that we could not discuss these in conference. We never had a chance to discuss these in conference. We've never debated this on the floor. We debated it briefly in committee. And so I don't know why that has to be in here. Mr. President, I urge that we send this bill back to conference to do three things, which will be toward the one Minnesota that our governor is so keen on, and toward the unity that we talk about working together and getting things done, which is what people want us to do, Mr. President. If this bill goes back in about an hour, they could fix the hospitals, they could fix the mental health, and they could restore. They could take this abortion stuff out, and you all could declare a victory lap and say, well done, look what we did, and we can move along. So, Mr. President, I urge a green vote on the motion to not concur.
Mr. President, they're working here. I don't know if it's on all or not.
Testing? Yep, mine works.
Test, test.
Testing.
The Senate will come to order. You notice that I was so used to speaking in that mic. The Senate will come to order. Just so everyone is reacclimated, we know the last speaker was Senator Abler. He had just finished. We'll now go to Senator Grudenhagen. So we'll make sure Senator Grudenhagen has a mic.
Testing 1, 2, 3.
And Senator Coleman, okay? All right. Senator Grudenhagen, if you be thoughtful, because there's only so much interaction that we can do, but we'll make sure that we do our absolute very best. And I know Senator Coleman probably feels very comfortable with these mics because she's done this over and over again. Here we go. Senator Grudenhagen.
Well, thank you, Mr. President. Yeah, I would also rise in support of Senator Utke's motion to re-refer. There's been a host of comments about the shortcomings of this bill, the lack of transparency, and for the public to review. And I would strongly support that. I'll just pick out a couple things that I would consider also a reason to re-review this bill, re-refer this bill. So, Mr. President, if Senator Wiklund would yield for a question.
Senator Wiklund, will you yield? She will yield. Senator Grudenhagen.
Oh, thank you, Mr. President. Thank you, Senator Wiklund. Say, when the bill left, it had a $500,000 penalty for hospitals if they didn't control certain costs, which again, in my opinion, was like putting a lid on a boiling pot of water and would lead to rationing and less care for some of our most vulnerable citizens and children. But my understanding is that's been removed, but I did notice that the Healthcare Affordability Board was moved to the Minnesota Department of Health. What was the rationale for that, and do they still have an ability to penalize hospitals if they don't control their cost?
Senator Wiklund, to the question.
Thank you, Mr. President. Thank you, Senator Grudenhagen. Yes, the Healthcare Affordability Board provision has been modified significantly since it left the conference committee or left the floor here. We have modified it to become, it's called the Center for Healthcare Affordability. And this will be established in the Department of Health in their Health Economics Division, I believe. And with that center, we will be able to conduct research on and analyze the drivers of healthcare spending growth in order to increase transparency and identify strategies that help to reduce waste and low-value care, eliminate unproductive administrative spending, enhance the provision of effective high-value care, consider the sustainability of healthcare spending growth and the relationship of healthcare spending growth to health equity, to identify delivery system payment and healthcare market reforms to increase healthcare affordability. So those are all the types of things that will be examined in this center, and they will be able to conduct research, and they will be able to collect data. They'll be requesting public input at public hearings that are held at least annually to share their initial and final analysis that are conducted. There will be reporting, and there will be delivering recommendations. And so there will not be in this form the target setting that was in the Healthcare Affordability Board. There won't be an appointed board, and there won't be penalties for exceeding healthcare growth targets.
Senator Grudenhagen.
Oh, thank you, Mr. President. Thank you, Senator Wiklund. So will they have the ability, are their recommendations going to become mandates? Or it's who are they making these recommendations to, and do they have the ability to impose fines on our local hospitals? Or has that been removed?
Senator Grudenhagen, are you asking her to yield?
Yes, if Senator Wiklund would yield.
Senator Wiklund, will you yield? She will yield. Senator Grudenhagen.
Well, I asked her the question.
Did you hear the question, Senator Wiklund? Senator Wiklund.
Mr. President, I think I heard the question, and no, there's no ability to impose fines on hospitals, excuse me, for penalizing them for exceeding growth targets. That has been removed.
Senator Grudenhagen.
Okay, thank you, Mr. President, Senator Wiklund. Members, this is still putting the camel's nose under the tent. what is optional today will be mandated tomorrow. So I have great concern about this healthcare affordability. Again, members, we're creating more bureaucracy when bureaucracy is the problem with our healthcare system, as I said earlier. I think in 2020, we spent in this nation $4.3 trillion on healthcare. Over a third of it, members, was on bureaucracy. So all Obamacare did, it bloated the bureaucracy, skyrocketed premiums and deductibles, and created less care. Remember, when I was on HHS, we had a report in 2017, this is after Obamacare was implemented, that over 1.3 million Minnesotans did not access the care that they needed, not that they wanted or desired. That's the direction more and more government and bureaucracy is taking us, and this board is simply a step in the wrong direction. It should be removed from the bill because it's going to take us towards rationing, in my opinion. Again, this is the first step. The other thing I'd like to comment on, although I am thankful the fines to the hospital of up to $500,000 has been removed. So thank you for that, Senator Wiklund. The other thing I'd like to comment on is the public option. Members, this bill takes us another step towards single payer. We can look at the history of single payer, not only in the United States, but also across the country. We see that single payer leads to rationing and less care. We also see that costs skyrocket along with government bureaucracy, which is the opposite direction of what we need to go. So we see failed experiments on single payer, both in terms of Vermont, California, and I could go on. Remember, members, the public option is going to reimburse at probably a Medicaid rate or Minnesota Care rate. Doctors and hospitals lose money on these reimbursement rates, along with Medicare. The only way to maintain government health care programs is by having a strong, vibrant private health care system that bails out the losses of government health care. So this bill takes us in exactly the wrong direction. You expand hospitals and doctors are already losing money on the government reimbursement. And the amount of people on government reimbursement due to the demographic changes of the baby boomers retiring and a number of other factors is increasing. And therefore, private health insurance reimbursement is decreasing. This is a formula for disaster for our hospitals. And it was mentioned earlier by Senator Abler, we're not providing any money whatsoever on reimbursement rates to the hospitals, which evidently are based on the year 2018 when things have gone, and since then things have gone up dramatically. So, Mr. President, if Senator Wiklund would yield for a question.
Senator Wiklund, will you yield? She will yield. Senator Grudenhagen.
Well, thank you, Mr. President. Thank you, Senator Wiklund. With a $19 billion surplus, and the Democrats are raising taxes and fees another $9 to $10 billion, what was the rationale for not increasing reimbursement rates to the hospitals in our state?
Senator Wiklund, to the question.
Well, thank you, Mr. President. The rationale was that we had many investments that will be positively impacting hospitals. In the bill, we weren't able to keep every investment in addressing the hospitals in the bill, and I can tell you about some of them that are included. This bill will provide for restoration of funding for the Merck program after changes in the program mandated by the federal government threatened the program's continued existence. This Merck program provides critical source of revenue for teaching and safety net hospitals. We have provided for a reproductive health rate increase of 20% under public health care programs, so that will increase reimbursement rates. We are going to provide funding for the implementation of long-acting, now I'm blanking on the LARC coverage, which will allow for contraceptives to be placed in a hospital setting. That will help hospitals recoup costs for these contraceptives. There is a increase for and coverage for recuperative care. This will help hospitals with Minnesotans who are unhoused, who don't have a safe and stable place to continue recovery after a hospital stay. It will help them move on to that, excuse me, and not be held to staying in a hospital where the hospital is not receiving reimbursement for those days. There are reimbursement rate increases for adult day treatment services. I think that the bill has a pretty comprehensive approach to helping providers, and that includes hospitals. And we are doing that without, we weren't able to provide the rebasing provision that Senator Gruenhagen mentioned, but we are also providing a COVID-19 hospital rebasing adjustment. This will allow for disregarding utilization from 2020 claims so that future inpatient hospital rates do not depend on the pandemic year when hospital utilization was much different. We are also providing long-term care acute hospitals with implementing a new rate methodology, which will include inflationary increases. So those are just some of the ways. This particular line item we weren't able to include, but we have done other things to address hospital and provider reimbursement.
Senator Gruenhagen.
Oh, thank you, Mr. President. Thank you, Senator Wiklund. Well, I'm glad to see that there was some effort to provide some increases to our hospitals, because as you know, some hospitals are losing up to $1 million a day. And I know in the rural area, there was even a front page article a year or two ago, probably 2 years ago, in the Star Tribune that said many rural hospitals are barely hanging on for now. And again, they identified in that Star Tribune article that low reimbursement from Medicaid, Minnesota Care, and Medicare is what was stressing these hospitals. And again, we're seeing an increased number of patients with that type of reimbursement and fewer patients with private health insurance. So we've really got to address private health insurance reform that reinvigorates that market. My last point would be this, if Senator Wiklund would yield for a question.
Senator Wiklund, will you yield? She will yield. Senator Gruenhagen.
Oh, thank you, Mr. President. Thank you, Senator Wiklund. My understanding is that we're going to allow illegal immigrants to purchase Minnesota Care in this plan, up to 40,000 of them. Is that correct?
Senator Wiklund, to the question.
Mr. President, Senator Gruenhagen, yes, the bill includes the Minnesota Care Immigrant Inclusion Act. This will help us take a historic step towards coverage for all low-income Minnesotans. This will also allow us to recognize that there are essential workers who without status here who are having a challenging time accessing health care. And we know that by having access to affordable health care, that people access it when they need it, and then they don't wait until an emergency situation where healthcare is more expensive. We will see that there are benefits to doing this, and there is support for doing this from the healthcare community, because they see firsthand that health issues become much worse and more complicated as care is delayed. Expanding healthcare coverage means improving management of chronic conditions and catching issues early, lowering the use of emergency departments. This is supported by providers and healthcare systems in Minnesota, because they can see the benefits of allowing more people to have access to preventive care.
Senator Gruenhagen.
Oh, thank you, Mr. President. Thank you, Senator Wiklund. So members, we're going to allow over 40,000 illegal immigrants to access Minnesota Care, which again reimburses at similar to a Medicaid rate. This is simply going to overwhelm some of our healthcare systems. Again, I support legal immigration. We need legal immigration. You know, when you abort about 10,000 babies, unborn babies a year, over 50 years, that's about 500,000 future citizens. You're going to have legal immigration, which I strongly support. In fact, I was one of, I think, the only senator that attended the legal immigration ceremony out here in the rotunda. And again, as long as they come legally, I don't care what their ethnic background is. We need them here. And coming here legally gives them a better opportunity to become part of the middle class and get off dependency from the government. You know, when I attended that ceremony out here, there were probably close to 100 immigrants who took the pledge to be U.S. citizens. And one of the things I noticed, there was no fentanyl sales going on. There was no sexual abuse of women and children going on. There was no public health issues being brought into the state. We need legal immigration to give those individuals the best chance to become part of the middle class. And here again, we're incentivizing illegal immigration, which is going to bring illegal drugs in, crime, and public health issues. And the more benefits we give, the more we incentivize these people to go through a gauntlet that enriches the cartels, makes them multi-million and billionaires, exploits them, and many of them die, women and children, along the way, along with men. That's an inhumane system, and the last thing we should be doing, members, is incentivizing that system, especially these people, which again, I care about, to go through that gauntlet of exploitation. And then they owe thousands to the cartels, which simply increases their exploitation. So members, for this provision alone, it should be re-referred and changed. The other thing, members, we're increasing reimbursement by government, low reimbursement rates. This is not going to help our hospitals and doctors. It's going to go in the wrong direction. So members, there's a host of problems, and I didn't even talk about some of the other things in here, although I do appreciate, Senator Wiklund, your efforts, but I just think we're going in the wrong direction. This bill needs to be redone. It's 844 pages of mostly non-transparent information to the public. Public has little time to review it, much less we as legislators who are supposed to vote on it. So members, please vote green and re-refer this, because we're going to seriously cripple or damage or even close many of our medical facilities in this state. Thank you, Mr. President.
Senator Coleman.
Thank you, Mr. President. Would Senator Wiklund yield for a question?
Senator Wiklund, will you yield? She will yield. Senator Coleman.
Thank you, Mr. President. Senator Wiklund, I was wondering if you could walk me through where the funding for the Rare Disease Advisory Council started in this bill and then where it ended up after conference committee.
Senator Wiklund, to the question when you're ready.
Thank you, Mr. President, for the question. The Rare Disease Advisory Council funding in the Senate proposal as it left the floor, we had included the funding for the line item to maintain the current service level, to establish the base budget, and establish program capacity. The House had brought forward only the maintain current service level and establish the base budget. We talked about this, and I brought forward strong interest from the Senate to maintain the established program capacity, but I was not successful in convincing the House to accept that provision. And so coming forward to final agreement, we have included the maintain current service level line item. They will be able to establish a base budget, which you can see is 600, or I'm sorry, not that you can see, I'm sorry, we didn't have the spreadsheet handed out yet. 618,000 for the first biennium and 652,000 for the second biennium. And we do not have the funding for establishing program capacity. I believe that the Rare Disease Council will have to come back and tell us more about what the reasons are for needing the additional establishment of program capacity. I believe in the Rare Disease Council and the work that they do, and I would have supported and did support and encourage the House to accept this provision.
Senator Coleman.
Thank you, Mr. President. Thank you, Senator Wiklund, for your answer and for being a strong advocate for the Rare Disease Advisory Council. I believe I serve with Senator Morrison on this council, and the work they do is incredibly important in the state of Minnesota. The lack of funding that came from the House offer and that was accepted is reason alone to send this bill back to the conference committee and to put up a stronger fight for the Senate position and the governor's position on the amount of funding needed for the Rare Disease Advisory Council. I find it with sad irony that today of all days I am advocating for the Rare Disease Advisory community as it is Adam Coleman's 40th birthday. Not my Adam Coleman, but he would have been my brother-in-law. Born to Norman Laurie Coleman, was born 40 years ago today with a rare disease, Zellweger syndrome. Adam lived about 6 weeks before tragically passing away. His father went on to the United States Senate to become one of the largest champions for rare disease funding. And today, if you're born with rare diseases, or if you're born with Zellweger syndrome, that is, you can live to be up to 12 or 13 years old. And that right there in one family is a perfect testament to why we should be advocating as strong as we possibly can for every penny of funding for rare diseases. On average, it takes about 7.8 years to even get a diagnosis for a rare disease. And only 5% of the 7,000 rare disease communities have an FDA-approved treatment today. Members, this is an absolute critical piece for these families that are struggling and desperately trying to figure out what's going on with them and their children. We need to bring this back to conference committee. We need to put up a bigger fight for this small but critical community that needs our help. And I encourage a green vote on the motion. Thank you.
Senator Matthews.
Thank you, Mr. President. Unfortunately, as has been a theme here by this majority and in large number here recently, we have a bill before us here that grew to a gigantic size in the dark of night with no transparency behind closed doors. We had a bill that left this Senate at 500 pages, which is way too big already, came back at over 840 pages and just got released to us as senators and to the public at about 11:45 in the middle of the night last night. And this is not the transparency that Minnesotans expect. We can do so much better, and it is just so sad that we keep seeing this theme repeating itself over and over and over again. This bill has a number of problematic provisions in it, with the elimination of managed care that is in this bill, all of the problems with the public options, the funding that Minnesota taxpayers will be footing the bill for people who have entered our country illegally to come and participate in Minnesota Care and be a magnet for more illegal immigration into the state of Minnesota. But what is the most devastating to me and a large number of Minnesotans is how the provisions repealing bipartisan, common sense abortion statistics, abortion reporting requirements just get stuck in the middle of an 840-page bill in the middle of the night when there has been public opposition, bipartisan opposition to these bills moving forward on their own, and the majority decides we're just going to stick them in the middle of a giant omnibus bill and force them through that way in order to still get what we want when the majority of legislators here don't even support these provisions. Included is repealing the Women's Right to Know Act. In this bill, we're eliminating family planning grants, which allowed the Department of Health to make special grants providing pre-pregnancy family planning services. We're eliminating the Department of Health prohibition for using state grants to grant funds to nonprofits who perform abortions. So we won't even know who will all be allowed to provide abortions in this state, but apparently it's being expanded to nonprofits. We are eliminating the positive alternatives, and this came about in 2005, members, on a strong bipartisan basis, because it was studied at that time that among women who had had an abortion, a majority of them said that if one person had offered them support or assistance, they would have not made the choice to have an abortion. That coming alongside them, offering a hand up with some support, with some encouragement, with assistance where it's needed, gave women the ability to realize, I can do this, I can make it, I can bring my child into the world and give them the chance at life. And so we passed this Positive Alternatives program in 2005 to do just that, because we want to ensure that no woman is forced into having an unwanted abortion simply because of the lack of support or resources. And in 2005, nearly 20 years ago, this passed both bodies with huge bipartisan support. A vote of 112 to 17 over in the House. A vote of 53 to 11, here in the Senate. Bipartisan authors that helped carry these provisions through, Senator Dallas Sams and Representative Brad Finstad. And I've put out and distributed for you, members, a sheet that is clippings from the last 6 years of the abortion reporting forms that are on the Minnesota Department of Health website right now. The Department of Health is required to put together an annual report on abortions that are done in the state. And there is a page that is required in every one of these reports to discuss the Born Alive Infants Protection Act and how the state is following this specific statute in the law. Because members are trying to claim here that infants born alive and not being cared for does not happen. But I'm handing out the evidence that the state Department of Health themselves are reporting that this has happened multiple times over the last 6 years. As you can see, in calendar year 2021, 2019, 2018, and 2017, and those are just the ones in the most recent reports that we found out, there are some cases described where the infant had fetal anomalies, and there were some where the infant was pre-viable and not fully formed enough to be able to live even after surviving the abortion. But the 2021 report says that in 2 instances, there were babies born with no fetal anomalies, no issues of pre-viability, but comfort care measures were provided as planned and the infant did not survive. These are some of the most devastating words I have ever read on a state report. 2019 contained similar language saying in one instance, comfort care measures were provided as planned and the infant did not survive. 2018 gives similar verbiage again in the middle of the report, saying in one instance, comfort care measures were provided as planned and the infant did not survive. And 2017, once again, in one instance, comfort care measures were provided as planned and the infant did not survive. Current law today requires us that it says a born alive infant as a result of an abortion shall be fully recognized as a human person and accorded immediate protection under the law. All reasonable measures consistent with good medical practice, including the compilation of appropriate medical records, shall be taken by the responsible medical personnel to preserve the life and health of the born alive infant. That's current law, members. And it's even shocking to find statements such as this on our state reports when we have the law the way it is. But now, under this bill, we are eliminating all those reporting requirements. Minnesotans will never know how bad this in fact gets in the state of Minnesota. It's also striking out the words requiring medical personnel to preserve the life and health of the born alive infant, to only say provide care. But according to these reports, providing care is just essentially to do nothing except wrap them up and keep them comfortable until they die. That's not care, Mr. President. And even on a bipartisan basis, even among people of Minnesota that are pro-choice or support abortion, we should at least be able to agree on this, that babies who survive an abortion should be given every chance possible to be given the care needed for them to live. And this is shocking that we are seeing this devastation and this travesty to unborn children and children that survive abortions, that the state will no longer be requiring that care be provided for them to try to preserve their life, just the care to keep them comfortable until they are brought to their death. There are other major abortion provisions being repealed in this section, in addition to the born alive section that I just referred to. We're repealing the section of law that says it's unlawful to perform an abortion on a woman who is unconscious unless they are put under for a procedure to save the life of the woman. That should be a common sense measure that we all agree on. We're also repealing the requirement to report if a woman has died within 30 days after having an abortion for any reason, and within 90 days after an abortion if the cause was related to an abortion procedure. Why would we want that data repealed? Why would we not want to know if women are suffering and dying from abortion complications? Wouldn't that be something on a bipartisan basis Minnesotans would all want to know so we could prevent that from happening? But in this bill, in the dark of night, being jammed into an 840-page omnibus bill, is a repealer of such a provision. This is dangerous, members. This is dangerous. We're taking out informed consent. We're taking out the Supreme Court's original jurisdiction. And we're taking out the phrase in law that states that normal childbirth is given preference as the policy of the state over abortion. Are we this gung-ho on death, Mr. President, that we are stooping to the elimination of every common sense idea to try to help and preserve both the life of the mother and the life of the unborn, even those that survive and are born despite an abortion procedure? Very few things grieve my heart more than reading some of these phrases that we've had here today and the impact that this will mean for Minnesotans. The pro-choice movement used to claim the mantra of trying to make abortion rare, and it doesn't seem like that is happening any longer. We're trying to make it available as much as possible, and I guess pro-choice is limiting you to just one choice. If you're going to try to keep a baby alive who survives abortion, or you want to make the choice for life, all these state resources are getting yanked out from under you and being denied to the mother and the child. We can do better, and we must do better, Mr. President. And I believe an overwhelming majority of Minnesotans, including many who are in support of abortion, would also want us to do far better than we're seeing in this bill before us. Members, I urge you to reject this bill. Let's send it back to conference committee and get this right.
Senator Rasmussen.
Thank you, Mr. President. Would the bill author yield for a question?
Senator Wiklund, will you yield? She will yield. Senator Rasmussen.
Thank you, Mr. President, and thank you, Senator Wiklund. Senator Wiklund, as a part of the conference committee that produced this report, could you tell the body at which conference committee meeting a member of that conference committee could have offered an amendment to be discussed and voted on?
Senator Wiklund.
Mr. President, Senator Rasmussen, we had more than one meeting where members heard an overview of the spreadsheet, and then we met today. We discussed the conference committee report, and members have been able to speak with me about particular provisions that they're interested in. We worked collaboratively with the House and with the administration to come up with the provisions that are included in the conference committee report. The bills that were heard all through session and included in our omnibus bill, you'll see many of them are reflected in the final conference committee report, as are many of the House provisions that were similar or same. There are some things that we did not accept that they brought forward, and some that they did not accept of ours. So that's how we put the bill together.
Senator Rasmussen.
Thank you, Mr. President. I had the pleasure of serving on two different conference committees this year, and in both of those conference committees, I was, as a member, was given the opportunity to offer amendments, to make motions. My amendments oftentimes weren't successful, but I was able to offer amendments as a part of the process. And so if, would Senator Wiklund yield for another question?
Senator Wiklund, will you yield? She will yield. Senator Rasmussen.
Thank you, Mr. President. Thank you, Senator Wiklund. So, Senator Wiklund, I guess just maybe a yes or no question would be better. Was there a conference committee meeting for your conference committee that produced this reports where a member of that conference committee could have offered an amendment to be discussed and voted on as a part of that conference committee?
Senator Wiklund.
Mr. President, Senator Rasmussen, I just indicated how we had meetings to review the spreadsheet, and we had a meeting to review the conference committee report today.
Senator Rasmussen.
Thank you, Mr. President, and thank you, Senator Wiklund. And just for members and for the public to understand this process, at 11:54 p.m. last night, the bill was released to the public. And there was not a single conference committee meeting where a member of the conference committee could offer an amendment, could even move sections of the bill, same and similars. And this is about an 845-page bill. And we've been hearing from Democrats this session about how much they care about preserving democracy. And so, Mr. President, would Senator Wiklund yield for a question?
Senator Wiklund, will you yield? She will yield. Senator Rasmussen.
Mr. President, thank you, Mr. President. Thank you, Senator Wiklund. Senator Wiklund, is this what democracy looks like?
Senator Wiklund, to the question.
Mr. President, Senator Rasmussen, I guess that's kind of an abstract question. I think democracy is that we work together to create the bill that left the Senate floor. It was a very collaborative process. I involved hearing bills from bipartisan authors, and we put that bill together. The House passed their bill, and we worked together to come up with a final conference committee report with the input of, the stakeholders who had been involved in the original bill development. Many of our provisions are similar. We're similar to each other. Would I have liked to have more time now? Yes, I would have liked to have more time, but given the work that we had to do to get the bill put together, which was very time-consuming, and the production of the bill, which is extremely time-consuming for the revisor's office to create the final documents, we simply aren't able to do that. I will say that it has been discussed that this bill is greatly expanded from when it left the floor, and I would like to point out that we'd heard multiple policy bills on the floor in the Senate from the Department of Health and the Department of Human Services, and most of that, or virtually all of it, was included in this omnibus bill, which is not my preference. I would like to see policy bills leave the floor and then be passed in the other body and do it that way, but in this case it did not work out that was going to be possible. So we were able to incorporate that policy in this bill. So members have had a chance to review and discuss those policy provisions on the floor of the Senate.
Senator Rasmussen.
Thank you, Mr. President, and thank you, Senator Wiklund. And I guess maybe we'll have some support here to give this conference committee some more time to do the work in the proper way that allows the members of the public to better understand what's going on. It has respect for the legislative process, Mr. President, and so hopefully we'll have a bipartisan vote here to send this conference committee report back so that this can be done correctly, because I don't think this is what democracy looks like. I don't think this is what Minnesotans were promised, and I don't know what the Democrats' excuse is. They have complete control of state government. And I don't know why we have an 845-page bill being released at 11:54 p.m. last night without a single conference committee where a member of that conference committee could have made a motion, could have offered amendments, could have had votes and debate. And so, Mr. President, I hope we do the right thing. I hope we take the time to get this process right and that we send back this conference committee report to have a more open and transparent process that will better serve Minnesotans. Thank you, Mr. President.
Senator Latz.
Thank you, Mr. President and members. I'm here to set the factual record straight on something that Senator Gruenhagen said earlier about crime rates involving undocumented immigrants. I was not planning to speak on this bill, but I cannot let the factual inaccuracies persist in the public record. So I looked it up online, and I found the Proceedings of the National Academy of Sciences, which is a peer-reviewed journal of the National Academy of Sciences and is an authoritative source of information. This is published online from the U.S. Department of Justice. And here's what a study determined using uniquely comprehensive arrest data from the Texas Department of Public Safety to compare the criminality of undocumented immigrants to legal immigrants and native-born U.S. citizens over a 6-year period. The study found that undocumented immigrants have substantially lower crime rates than native-born citizens and legal immigrants across a range of felony offenses. Relative to the undocumented immigrants, U.S.-born citizens are over 2 times more likely to be arrested for violent crimes, 2.5 times more likely to be arrested for drug crimes, and over 4 times more likely to be arrested for property crimes. The proportion of arrests was relatively stable or decreasing over that period of time involving undocumented immigrants. And the data was robust to using alternative estimates of the broader undocumented population, alternate classifications of those counted as undocumented at arrest, and substituting misdemeanors or convictions as measures of crime. In other words, the data is undocumented immigrants commit crimes at substantially lower rates than legal immigrants and U.S. citizens. So let's just put to rest the canard that undocumented immigrants bring with them a wave of crime. It is just factually false. And I'm afraid sometime earlier this session, I believe, I had to make a similar statement. So there's no value to repeating the falsehoods any longer. Thank you, Mr. President.
Senator Weissenberg.
Thank you, Mr. President. I stand here today saying we need to send this bill back. It's a horrible bill, and Health and Human Services letting infants die sure isn't healthy. I ran this last summer, and I told citizens about H.R. 4712. That's where Governor Walz voted against saving babies after they're born alive. He calls this women's health care. Health care isn't allowing a baby that is born alive to lay there and die. Now, in the bill, we changed preserve life and health of a born alive infant, where if you wanted to preserve the life and the health of a born alive infant, you would leave that language in there. It is changed to say care for the infant who is born alive. Now, Mr. President and Minnesotans, I've had it explained to me and heard through other people talking here that care could be explained as wrapping a child in a blanket to provide it comfortable care and letting it die. Now, Mr. President, we changed the language to save babies, and now we're just going to let them die, and this is happening. I told people last year when I was running that if the Democrats won, we were going to have after-birth abortion, and that's what happened. They didn't believe it. I showed them this. You can look it up on MCCL's website, how Walz voted, and that's what we're voting for here today, is to let babies die. 71% of Minnesotans think that there should be some restrictions on abortions. And they said that it's what we were talking about in January was extreme. No, it wasn't extreme. We're saying we want to save babies that are born alive. This is a Minnesota statute. 343.21 subdivision 2 says, no person shall deprive any animal over which the person has charge or control of necessary food, water, and shelter. You have to give animals food, water, and shelter and keep them safe. Minnesota statute 343.36, no person shall operate, run, or participate in a game or contest in which a pig, greased, oiled, or otherwise, is released where the object of the activity is to catch the pig. Any violation of this is a misdemeanor. If we violate, Mr. President, the health and life of animals, it's a misdemeanor, but we can let babies die, and that's okay. That's what this law says. If you harm animals, you can be required to do community service and also require the person to receive psychological, behavioral, or other counseling. I hope that people that let their babies die are required to also go through counseling because that is needed. We cannot be doing this, Minnesotans. I hope people wake up, Mr. President. We can't be doing this. You have to pay attention. We're not up here spewing lies. We're telling you the truth. Open your ears and listen. We're letting babies die. We have to send this back. Thank you, Mr. President.
Senator Duckworth.
Thank you, Mr. President. I appreciate it. I just have a couple of questions for the bill's author, if Senator Wiklund would yield.
Senator Wiklund, will you yield? She will yield, Senator Duckworth.
Thank you, Mr. President, and thank you, Senator Wiklund. I have nothing but tremendous respect for you and the work you do here in the legislature. And the questions I have really aren't to do with abortion rights. They're more so questions about what we do in this state when a baby is born alive and or viable. So the first question I have is in regard to a state statute that's repealed in the bill. And this is the language that would no longer be state statute as it relates to this bill. It states a potentially viable fetus, which is live born following an attempted abortion, shall be fully recognized as a human person under the law. And so my question is really just a question I think that many people in Minnesota have, which is, what is the reasoning behind pulling this verbiage out of state statute?
Senator Wiklund, to the question.
Thank you, Mr. President. Senator Duckworth, I think for me, the reason for pulling out this language is that it doesn't reflect how people experience these medical events that are, excuse me, many times traumatic events for families. It requires reporting. It requires doctors to report, to surveil and report on their abortion patients, and it's unlike any other healthcare procedure. What I think the Born Alive, that statute is doing is putting families in who are already in a very difficult situation, even in a further difficulty and producing more shame and stigma in a very traumatic event in their life. For me, doctors are under great responsibility to provide care, all care necessary to help their patients, all of them. And to say that just by having this in place that somehow doctors are going to be doing something differently, to me is not responsible for us to have this in statute. And thank you.
Senator Duckworth.
Thank you, Mr. President. Thank you, Senator Wiklund. I appreciate that. And although we may have a difference of opinion, I certainly respect yours. You know, it's interesting that as a part of that explanation, we talk about doctors providing all care necessary. Well, in this instance, I think one of the reasons why a state statute currently says that a viable fetus that is born shall be fully recognized as a human person under the law is to afford them the right to that life-saving care when we talk about all care being necessary, which leads me to my next question, which happens to be about Section 56. Section 56 in the bill was mentioned earlier, and what it does is it strikes and changes current state statute. It makes this change. It states that responsible medical personnel are required to care for the infant who is born alive, rather than what's current law, which is this. Responsible medical personnel are required to preserve the life and health of the born alive infant. So, Mr. President, I would ask if Senator Wiklund would yield for a question.
Senator Wiklund, will you yield? She will yield. Senator Duckworth.
Thank you, Mr. President, and thank you, Senator Wiklund. The question I have on behalf of the people of Minnesota is, why in this instance would we change state statute to require a lesser standard of care for a baby that's born alive?
Senator Wiklund.
Mr. President, I do not believe that that is what we are doing, that we are not imposing a different standard or lesser standard of care. I do think that there are other members of the body who may be able to answer the question more directly than I can, but I do not agree that this is somehow putting in place a lower standard of care. Doctors are responsible for caring for their patients, and they have that through their training, and they need to take care of people and in all these situations.
Senator Duckworth.
Thank you, Mr. President. I guess the rhetorical question I would ask is, if we're not changing the standard of care, then why are we changing the law? If Senator Wiklund would yield for one more question, please.
Senator Wiklund, the ask is for you to yield for one more question. Will you yield? She will yield. Senator Duckworth.
Thank you, Mr. President. Thank you, Senator Wiklund. And I get it. I, too, don't have obviously, in-depth experience as it relates to the practice of medicine, et cetera. So I understand that others might be a little bit more well-versed or able to answer the question better. And that's not meant as a slight by any means. I'm just acknowledging the fact that some of us aren't medical doctors, myself included. If your belief is that the language being care for the infant who was born alive is no different than preserve the life and health of the born alive infant, I guess could you explain to me how those two are the same standard of care in your mind?
Senator Wiklund to the question.
Mr. President, Senator Duckworth, I believe that it does require doctors and providers to adequately care or provide all necessary care when they're taking care of patients. And this repeal of this will not change their responsibilities.
Senator Duckworth.
Thank you, Mr. President. Thank you, Senator Wiklund. As I said before, I do have tremendous respect for you. I think we're just going to have a difference of opinion as it relates to the language that we're discussing. I think to folks who were to read the language or observe the change, number one, the change is occurring for a reason. Why else would we say we're no longer going to require these medical personnel to preserve the life and health of the born alive infant and simply change it to care for the infant who is born alive? The fact that we're making a change to that language shows or would prove to me there is some sort of difference between those two things, which is why we're making the change to the law. And while I am not a medical professional by any means, I do happen to be an emergency medical responder. And on occasion with the fire department, I respond to medical emergencies. And I can tell you that once before, many times, I've had to provide CPR to folks. One instance in particular, I went from providing CPR to a gentleman on the floor of his home to continuing to do CPR on him while he was on a stretcher. I continued to do CPR on him, bouncing around in the back of an ambulance, and I continued to do CPR on that gentleman all the way into the emergency room until I was looking across his body at the medical professional in the ER, ready for me to stop doing chest compressions and turn it over to them so they could continue to try to provide life-saving care. If we're willing to do that and stop at almost nothing to revive and give an adult male in his 50s or 60s or what have you a chance at life, why in the world will we not also do it for a baby who was born alive within the first few seconds or minutes of them being outside the womb? I don't see a difference there. And I think that's why we had language, or there is language right now on the books that talks about that born alive infant being fully recognized as a human person under the law. If I would provide chest compressions and CPR to a grown adult male for that long, you bet your life I'd do the same for a baby that had a chance at life as well. That's what's missing in a part of this conversation, Mr. President. You know, at the beginning of this session, we talked about the abortion law. It was a lengthy debate. It was an emotional debate. And I respect my colleagues on the other side. We have a very substantial difference of opinion. But a part of that debate they shared with us over and over again, and to the people of Minnesota, they said, we're not going to change the law in Minnesota as it relates to this topic. We're merely codifying law. Well, here we are just a few months removed from those promises, and we are changing and striking current existing law that's on the books after promising Minnesotans we wouldn't do that. And the laws that we're changing and striking have to do with how we treat babies shortly after they're born. That's wrong, and it's why this conference committee report should go back to the conference committee. I don't care what else you do to the bill. If you keep everything else, just remove these repealers so that these young infants have a chance at life once they're born. Thank you.
Senator Lucero.
Thank you, Mr. President. As we wind down here in the final day of the legislative session, it is tragic the policies that the Democrat majority continue to put forward. In this bill, we have a multitude of terrible policies. So, Mr. President and members, it's a sad day. It's a sad day. So, Mr. President, I'm going to speak directly to Minnesotans across the state. Mr. President, and the great citizens and residents of the state of Minnesota, the Democrat majority has included a provision that is going to repeal the requirement to provide health-saving care for those infants, the most precious and innocent among us, that might be born alive as the result of a botched abortion. And that is something that I was a co-author of back in 2015. I co-authored the provision known as the Born Alive Infant Protection Act. And now, in the year 2023, the Democrat majority seeks to repeal it. Mr. President and members, this entire session culminated in this bill with this provision is the example of a long list of provisions, policies, and priorities that are against natural law, that defy all semblance of truth, and are certainly against God. Life is something we need to celebrate, we need to cherish, we need to uphold, we need to protect, and certainly the most innocent. And this bill with these provisions is the opposite of that. I'm reminded of words from the book of truth spoken many years ago by the prophet Isaiah. Isaiah said that there are people with hearts that have become hardened, with eyes that look the other way and have become blind, and ears that have become dull and do not hear. Why did he say this? So that with their ears not listening, they do not hear. With their eyes attempted to be closed and looking the other way, they do not see. And with their hearts, they become hardened. And that's what is happening with these provisions that get passed into law. That is the reason why I and those that stand for truth, natural law, and the words of the Lord continue to fight so hard for the precious and innocent among us. So, members, it is a sad day. It is a sad day. The other thing, Mr. President, there are many provisions in this bill I could speak against. But another that Minnesotans need to be aware of, that while Minnesotans are working hard to provide for themselves and their family, the Democrat majority has prioritized the hardworking taxpayers of this once great state, Minnesota, now having to provide and fund for foreign nationals, illegal immigrants. And in this provision, or in this, a provision in this bill, is going to require that Minnesota taxpayers provide health care for those that are not here legally. No prerequisites, no requirements, just come here, get on the dole, and Minnesota taxpayers will fund your health care. That is in addition to earlier provisions of giving out driver's license for those here illegally. There was a provision earlier that eliminates the citizenship requirement to participate in the election caucus process. We are providing free college tuition, taxpayer funded, free school meals, taxpayer funded, and all of these provisions are on the backs of the hardworking taxpayers across Minnesota. It is going to crush the state. The impacts are going to be devastating. And while Minnesotans are working for their own children and their own families, they're having to fund for the magnet that the Democrats are creating for Minnesota to attract people to come here and thinking that Minnesotans are just going to pay for everything. Mr. President, vote in favor of the motion before us to send this conference report back to committee so it can be reworked and have these terrible provisions removed. Thank you.
Senator Rarick.
Thank you, Mr. President. One more time this session, Mr. President, I stand to speak in favor of the motion to reject the conference committee report. And it's the same reason I've gotten up each and every time. We have failed to provide the people of Minnesota with the ability to have public input and understanding of what is in the bill and the proposal in front of us. There are many others in this chamber who can speak to the provisions of this bill far better than I can. This is an issue area that I do not get into. But we've heard from so many around the issues involved in this that once again, they have been shut out of the process, not allowed to testify why they're in favor or in many cases opposed to provisions that are being considered. And once again, here in the Senate, we are seeing provisions coming through in a conference committee report that went through the other body, but never came through this one. Maybe had a committee hearing or so, but never made it to the floor here. And many of the provisions that were from Senate File 70 exemplify that here. I think many of those provisions would never, ever have made it through this chamber on their own. But when we stick them inside a bill like this, they can be hidden, and members can turn a blind eye, say, well, that's not why I voted for this bill. And I can't speak as well as Senator Duckworth or Senator Matthews did on those, but I agree with absolutely everything they said, Mr. President. And it's funny, Mr. President, how sometimes things in life will reflect on others. And I think many of us, when we were campaigning this last year and all during session, we heard people asking us, pleading with us to work together, work across the aisle. And on Saturday at Pimlico Racetrack in the 6th race, there was a horse named Bipartisanship. And I think people were looking at that and they saw this as here, but as life sometimes does, the reflection was absolutely spot on. Bipartisanship came in dead last. What a reflection of this session. And I think Minnesotans would agree with that. That has not happened here in the Minnesota legislature at all. When we look at the provisions in this bill and how many things that have been worked together on, bipartisanship came in dead last. Members, vote green on the motion in front of you, because if you don't, this report will be an exclamation mark on this session, showing that Minnesotans had no input, that 1/2 of Minnesotans were not considered when things were coming forward. Members, support this motion and send this back, so at least one thing that we do will have some hope of bipartisanship.
Senator Makewaite.
Thank you, Mr. President. Members, I wasn't planning to speak after a certain senator spoke inaccurately about things that are in statute related to abortion, but there have been so many statements on the floor that misstate what pregnancy, labor, delivery is like. So I'm going to set the record straight. Abortion is the termination of pregnancy for whatever reason. There are a handful of people in the state of Minnesota every year who find out later in their pregnancy that for whatever reason, they cannot continue to carry the pregnancy to term. At that point, they make a decision to terminate. And what that means for those Minnesotans is that they induce labor, deliver their child. They have an epidural, and they spend the remaining moments of their child's life holding them, caring for them, singing to them, reading books to them, taking footprints of their feet, giving them names, and holding them while they die. And the reason this is so upsetting is because what the anti-abortion movement has done, Mr. President, is take the stories of these Minnesotans and twisted them into something that is not real, to insinuate that women and pregnant people are crazy and would wait to decide to have an abortion for no other reason than they just feel like it, more than halfway through their pregnancy. The answer to Senator Duckworth's question, what is the difference between the language as it is now and what is going to be put into statute, is that when a person terminates a pregnancy, later in their pregnancy, there is no such thing as life-saving care. I shared a story on everybody's desk. This is a woman I think about every single day. Her name is Deborah Dorbert. She was pregnant. She found out 22 weeks that she had Potter syndrome and that her son would not survive for more than a few minutes to maybe an hour after she gave birth. And she wanted to terminate her pregnancy, but she wasn't allowed to because Florida has banned abortion, which is the goal of the anti-abortion movement. It's not concern for people's health, well-being, infants, babies. It's about banning abortion and controlling people's bodies. So Deborah just gave birth and held her son Milo for 99 minutes. When he came out, she said, he struggled to breathe. You could hear him gasping for air. He didn't cry. He didn't open his eyes at all. But I mean, he struggled. Now, what I hear some of my colleagues saying is that in those final moments, they would rather a doctor steal that baby from those parents and perform CPR until the baby dies, instead of the parents being able to hold their baby, sing Three Little Birds and I'll Love You Forever, read that book to their child. The reason why we're changing the language is because the personal details of Minnesotans' most horrific days do not belong in a public report that is available to every single person in the state of Minnesota. Actually, everybody, it's online. The piece of paper that Senator Matthews passed out includes the incredibly personal details of Robin and his short life and his death. This is not appropriate, and we cannot continue to let the anti-abortion movement pretend like something is happening that is not. What is happening is people are making decisions about their pregnancies, inducing their labor, giving birth and holding their babies until they pass away. So now the statute will read, an infant who is born alive shall be fully recognized as a person and accorded immediate protection under the law. All reasonable measures consistent with good medical practice, including the compilation of appropriate medical records, shall be taken by the responsible medical personnel to care for the infant who is born alive. That's what it will read. So members, let's not pretend that we don't know exactly what is happening here, exactly why this was put into statute, and exactly why it's being changed. Thank you, Mr. President.
Senator Marty.
Thank you, Mr. President. I, too, wasn't going to speak, and I'm glad Senator McQuaid did as well. The discussion that has been happening the last few minutes on the born alive infants. Senator Duckworth, yes, the difference between the current law and the change in law is we will provide more humane care. These are children who have no chance at a long life. They have fetal abnormalities that are inconsistent with life. They're dying, and their parents want to hold them. And it is literally yanking them away from their parents to give them some meaningless medical treatment. Comfort care is what they need, and taking a child out of their parents' arms to give them some worthless medical treatment is not right. Give the child and the parents time together I think all of us know people who have lost a child the first day of life because they were in a situation like this. Treat them with humanity. Don't treat them with something as a talking point on abortion. These are parents who are suffering. They didn't want this to happen, but they want to hold their child for the few minutes they have. Let's let them do that. This bill is a huge step forward. It provides humane care for children. It provides responsible medical care for children. That's all it is, and twisting it to make it sound like somebody wants a baby to die is wrong.
Senator Uckey, the author of the motion. Senator Uckey.
Thank you, Mr. President. I've got just a couple things here to wrap up with, and then we can move on. A couple things that haven't been touched on yet that are important and further tell us why this should go back and be looked at again and have people's input, but some things that need changes. And this one happens to deal with the mandates that are contained in this bill that will be passed on to our health plans, for our health plans to cover. The effective date in the bill says that those mandates will take effect on January 1 of 24. Our health plans have already submitted their initial plans and rates to the Department of Commerce to be considered for this fall's plans that will be rolled out and sold to the consumers. This will require them to pull back everything they've already done and reevaluate and make a new proposal. We don't do this normally because of the fact we're already into that system. And so these should be changed to January 1st, 2025. Everyone can do their job appropriately, and the appropriate plans, offerings with pricing would be ready for sale then for the 2025. Another thing that just came out today refers to, actually very appropriate for what we're talking about. And over the last couple of days, we've heard about naming tax bills, etc. And when I was meeting with some people this morning, I had just jotted down possible name as healthcare on life support. And it went right into the news that came across. It was a national report. And it said in the nation, we have 646 hospitals at risk of closure. That's across the 50 states. But when you go down a little bit further, Minnesota is home to 13 of those. That's what provisions in this bill will do. It will make it harder on those providers and possibly cause some of those on the edge to have to go out of business. And what does that mean? My last district covered the far north. I went up against the Canadian border. I had providers up there that were providing services, but the system was struggling back in 2016 and in that era because of MNsure and the pricings. The price of health insurance had gotten to a point, and the mandates had gotten to a point that plans were pulling out. If you were a pregnant lady in Baudette at that time, your only option for health care under the plan that was available was to go to Duluth. And we all know that there are a number of quick visits as that progression goes. They become more in-depth and more regular as you get closer to delivery, but to drive 3+ hours for those short appointments, it just shows what we could be looking at in the future. if some of these rural hospitals close. We need them. If it's not only for, in this case, bringing children into the world, somebody has a heart attack, you have something serious that happens to you, and you've got to drive in an hour and a half or even more to get to health care, chances are pretty good you're not going to make it. So this just all goes back into the same topic of why we need to send this back, make some quick changes, but more importantly, let the public weigh in on this. They have had not a chance to say a single word, and I think that's the worst part of all of this. This has all been done quietly and privately, and I think we can do better. Mr. President and members, let's vote to send this back and put some transparency in the system.
The Secretary would take the roll on the motion to reject the Conference Committee report. Members, please vote. For Senator Bowden, for those members voting pursuant to Rule 40.7.
Thank you, Mr. President. I report that Senator Herr votes no.
Senator Herr votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Port votes no.
Senator Port votes no.
And Senator Zhang votes no.
Senator Zhang votes no. Senator Rasmussen, for those voting under Rule 40.7.
Thank you, Mr. President. Senator Barr votes aye.
Senator Barr votes aye. Members, we're going to have to wait a little. There are some members who are coming from other locations, so we want to give them an opportunity to join us. Thanks for your patience in advance. Senator Bowden, for those voting under Rule 40.7.
Thank you, Mr. President. I also report that Senator McEwen votes no.
Senator McEwen votes no. Just so you know, Senator Hurd voted in person. We're still going to wait a couple minutes. All senators having voted who desires to vote, the secretary will close the roll. There being 32 ayes and 34 noes, the motion to reject the conference committee report does not prevail. Members will on the underlining motion, the secretary will take, it's my understanding a roll call was requested and a roll call was granted. The secretary will take the roll on the motion to adopt the committee report. Members, please vote. Members, please vote. Senator Bowden, for those voting under Rule 40.7. She needs the mic, someone. Senator Bowden.
Thank you, Mr. President. I report that Senator Mann votes aye.
Senator Mann votes aye.
Senator Port votes aye.
Senator Port votes aye.
And Senator Zhang votes aye.
And Senator Young votes aye. Senator Rasmussen, for those voting under Rule 40.7.
Thank you, Mr. President. Senator Barr votes no.
Senator Barr votes no. Senator Bowden, were you also supposed to report for Senator McEwen? You did not report for her. Will you let her have the mic? Thank you so much. Senator Bowden, for those voting under Rule 40.7.
Thank you, Mr. President. I also report that Senator McEwen votes aye.
Senator McEwen votes aye. All senators having voted who desires to vote, the secretary will close the roll. There being 34 ayes and 32 noes, the motion to adopt the committee report prevails. The secretary will give the bill its third reading.
Senate File Number 2995, a bill for an act relating to state government, modifying provisions governing child care, child safety and permanency, child support, etc.
Third reading, Senator Duckworth.
Thank you, Mr. President. I appreciate it, and I appreciate the opportunity to have shared comments earlier and trying to lobby for this bill to go back to conference for improvement. I gave what I thought were, pretty respectful, thoughtful comments. Then I was later accused of advocating for babies to be stolen from their parents in the midst of having just been born. And clearly, that's not the case. I want to get back to the point that I was making, in which there is a big difference between life-preserving care and comfort care. The example I gave earlier was life-preserving care and trying to give somebody CPR to resuscitate them, save their life, and give them a chance at recovering. And that's very different than the comfort care my family provided my grandfather when he was passing away from pancreatic cancer. At that point in time, it was comfort care, as was mentioned earlier. And that's the kind of care that's laid out in the bill. Life-preserving care is what's stripped out of the bill. And I'll give you an example, Mr. President, of why I would have liked this to gone back to conference committee and have further considerations, because I think we could have done both, or I think we could have provided some clarity that clearly must be missing here if people think I was advocating for small babies to be stripped out of the arms of their parents at the time of birth. I think folks know me well enough to know I have a much bigger heart than that. We could have come up with language that said something to the effect of, let's provide them care to preserve their life and health, and also in the case in which the life of the child is deemed not viable, that responsible medical personnel are required to care for the infant who was born alive. You see, but what happened, Mr. President, is by the time we got our hands on this conference committee report, the bill and the language, to Senator Rasmussen's point earlier, we weren't able to have that conversation and suggest just a modest bipartisan improvement to the bill, which could have made it achieve the purposes of both Republicans and Democrats in this instance. So, Mr. President, I'm not regurgitating any specific talking points regarding a particular issue. I'm not pretending to ignore anything or some of the heart-wrenching situations that parents, new moms, dads find themselves in when it comes to the birth of a child who they were hoping and praying would be healthy, that they'd have a chance to raise, love, and care for. Those heart-wrenching situations happen. I know sometimes when someone doesn't make it to the hospital in time, it's the fire department that's there to deliver that baby along with that mom and dad. And the furthest thing from my mind would ever to be removing that child from that parent. But if that child's life is in danger and we can save it, it's important that our state law reflects that that child is entitled to life-preserving care. If it's deemed that that poor baby, if their life is not viable, then of course we're going to honor and respect and provide it humane treatment and care and allow it to be with their parents, Mr. President. This bill should have that kind of clarity if we're going to be changing the laws on the books here in Minnesota. Thank you.
Senator Gruenhagen.
Testing. Oh, there we go. Oh, thank you, Mr. President. Yeah, you know, I rise in opposition to this bill. Just a couple quick comments. One, I wanted to respond to Senator Latz's comments about crime and illegals. Number one, when they cross the border, they're committing a crime. Just review your federal laws. Number two, we are killing over 150,000 of our young people in this country with fentanyl overdoses. That's 3 times more than the Vietnam War, and it's coming across our southern border. Number 3, we have terrible crimes committed against the illegals, and we enrich the cartels of sexual abuse, murder, and a host of other crimes that they have to go through. We don't need to incentivize this. We need to promote legal immigration. The other thing, last comment, is this bill is another bill supported by Planned Parenthood. It has a number of provisions about abortion. Planned Parenthood and Margaret Sanger is a white supremacist, a racist, and a eugenist organization. And I know they've disavowed her, but they're practicing the same philosophy today. In New York, they abort more black babies than are born. So members, if you vote for this bill, you're supporting a white supremacist, a racist, and a eugenist organization. Please don't do that. Vote no. Thank you, Mr. President.
Senator Jaskowski.
Thank you, Mr. President. Members, I'm going to speak about one provision in the bill, and that's the provision that's received a lot of discussion recently. Page 217 of the bill, section 56, redefines the Born Alive Act it changes the Born Alive Act, Mr. President, into something it wasn't. I was a co-sponsor, Mr. President, on Representative Abigail Whalen's provision, the Minnesota Born Alive Act, and that's what this is to protect the life of someone after they're born. And members, I'm going to ground us in reality. I've heard discussion to suggest that this allows for medical care of the baby after they're born, after a botched abortion. Well, if that's the case, Mr. President, why do the Democrats strike the word medical from the provision? The word medical is stricken from the title of this provision. It's a deliberate strike of the word medical to suggest that it is okay not to use medical technology to address the needs of a struggling baby after they were born. Members, we heard the abortion debate, House File 1, Senate File 1, the first major bill to come before this body. And the argument among the Democrats was, well, this just addresses the Dobbs decision from the Supreme Court. It does nothing to law. It doesn't change any of our state laws. Well, members, the Democrats have come back in this bill and changed all of our state laws and all of the protections that are in there for the most innocent among us. And in this provision, members, when we go in the course of life of a baby and we go across the point of irrefutable demarcation of life, that even the Democrats can't refute is life. They want to allow the circumstances to finish it off. And that's what they do in this bill. It is a sick, sick ideology that is penetrating from the radical elements of the Democratic Party in this state. Members, please vote no on this bill. This is a travesty to the meaning of life. It is a disregard and disrespect for human life. And the Democrats in Minnesota want to write it into law. Thank you, Mr. President.
Senator Uckey.
Thank you, Mr. President. And we've had a lot of topics that have been brought up before us here so far this afternoon. And there's been a little mention of some good things, and there are some good things in the bill. One that I highlighted that I had asked for to be revisited when the bill was on the floor the last time was the income verification process that all of our counties will be going through. And when it came back now, it is fully funded. So thank you, Senator Wiklund, for that. There are other things that have come in, and a lot of them fall under the terms of mandates. And I've highlighted what a problem the mandates are, but for some people, those various mandates are very welcome. And we're not saying they're bad, it's just the process. And that process and objection will continue because we can't just mandate these things and expect them to miraculously happen without there being costs. But there is still one thing that I would dive into a little further that is concerning, and it plays a big part in our rural areas, and that is the projected elimination of the managed care. It appears to be well more than a study, that it's an implementation plan signaling that they want to end managed care as we see it. Studies in the past have shown that managed care provides a higher quality health care at a lower cost of service. Even from the federal government, their recommendation, by contracting with various types of MCOs to deliver Medicaid program health care services to the beneficiaries, states can reduce Medicaid program costs and better manage utilization of health services. Improvement in health plan performance, healthcare quality, and outcomes are key objectives of Medicaid managed care. 41 states use managed care. No one is moving away from it. I wonder why we are even looking at it. Minnesota went to managed care back in the early 1980s because of healthcare access problems and cost. The state couldn't manage the program, so they turned to MCOs. What has changed? It's been good for a lot of years. I think we can just use history as our study, and I don't think we have to spend a lot of money and time doing that. Managed care is a way for the state to use financial incentives to improve quality. Will the state do the same through DHS? How does this improve health care for low-income Minnesotans? What assurance is there that this will happen, or is this just an experiment? And again, we don't need to experiment. We've been doing this for 43 years, or at least that's when we first looked at it, and it's been going for a long time. You may hear members say this needs to happen because in 2022, MCO margins were bigger than normal. But remember, if an MCO collects more money than they need to pay claims, it needs to be returned to the state. That is in statute. The MCOs are not keeping this extra money. And 2022 is probably there's probably an easy answer to that. Remember COVID? There's a lot of people that did not go to the doctor because to go in a medical facility, you had to wear a mask. And I know a lot of people that did not do that. If we watch the flow of cash and the amount of claims that they have in the next 12 months, you'll probably see that all level out because there have been people sitting and not going in unless it was urgent care, but they were not going to do the extra things until the COVID restrictions were removed. Thankfully, they have been, and I think you'll see people going back and getting on track with their health care again. I talked earlier about the mandates and how it affected our insurance companies and the timing on it, our health plans. But let's talk a little bit about those that purchase these plans. Because of the mandates that are proposed, and again, like I commented earlier, they're not all bad. We're not saying they're bad, but the process is bad. When we mandate something, we automatically set the bar pretty high. These things could be accomplished much better if there was a negotiation between the health plans and interested parties and come up with a mutually agreed upon solution. But in this case, we're just saying, no, you will cover it. So what can the consumer expect? Well, if you add up everything that's mandated at this point, roughly $1,200 to $1,300 additional cost per year for a family of four. That's significant. That's probably equal to 1 month's premium, thereabouts, depending upon the age of the family. And then all mandates are not applied equally, but the individual market gets hit with them all. That part is not fair, and we need to make sure that if we're mandating something, that the commercial market, MA, CGIP, all included are treated the same. And for those type of reasons, when we take a look at the mandates, the abortion language that's come back in, and anything that moves us towards a government-run, single-payer healthcare system, I cannot support a bill like this. It has, even though it's got some good things, as I mentioned, we've got some very toxic pieces of policy, and it's just too bad we couldn't have done better, but that is what's before us. So I would ask for a red vote. Thank you, Mr. President.
Senator Nelson, and then we're going to the ranking member, Senator Abler. Senator Nelson.
Thank you, Mr. President. Well, I had not really intended to speak today, but is on this particular bill. But as I listened, I realized I cannot be silent. The first is the issue of mental health. You know, that's always been a concern. It's been a growing concern, and COVID just exacerbated the need for mental health services. And there is such a lost opportunity here. When we had a $19 billion surplus, one would think that the state of Minnesota would focus, yes, on tax relief, but also on those very critical issues that affect us all and that are even more critically in need following the years of the pandemic. And I'm speaking about mental health care. And it is really a lost opportunity that this bill does not adequately make investments in mental health care. 40% of mental health is paid for through Medicare, through Medicaid. And the challenge is that 40% of mental health care is paid for through Medicaid. And yet there is a huge, at least 40% paid through Medicaid. But Medicaid rates are not sufficient to pay for the cost of the care. In fact, Medicaid rates pay about 3% of the cost of the care for mental health care. I think it is a tragic, lost opportunity that this legislature, particularly at this time of a greatest need for mental health care services, did such a poor job of investing in these services. I think it's something that we will live to regret for years. I'm hoping that we can change that. And then the second piece is government-run health care. We have the best health care in the world right here in Minnesota, and anything that would think that private-run health care, the best-run health care in the state of Minnesota, should be dictated by the government and government mandates, I think is too hard to even comprehend that someone would think that. But there are evidences in this bill that that is the case. And the last piece that I will mention is, as I was listening to the debate about children who are born alive, in cases of specifically when the intent was an abortion. And we heard many discussions about those very tragic situations and ideas that certainly we should, there's one piece that I'm going to share with you that has not been said, and that I think it's important in this discussion. As this was percolating, I spoke to a friend of mine who is an obstetrician, retired now, but I wanted to ask him about this aspect of children who survive an abortion and what happens. And I will never forget what he said to me. This has not been mentioned in the conversation today, but I think it should be. He told me that when he was a fellow, and was performing an abortion, that the child was born alive. And he asked his senior obstetrician with him there, what do I do? And he told me that he was told to put a pillow over that child that was born alive and let it die. Now, those are chilling words, and they sunk into my soul, and they should across this state. Now, I will say that was a shocking. This gentleman now is in his 80s, and he still had tears in his eyes. I think we cannot forget that as we listen to end the debate on this bill. Thank you.
Senator Abler, ranking member.
Thank you, Mr. President. I appreciate that. And, you know, I do not have any long amount of thoughts. Just a couple thoughts to kind of wrap it up. I do want to thank Senator Wiklund for her good leadership in the committee. I just wish this could be a little different discussion that we're having. And this bill could have been so much better, but I want to remind people that there is a tremendous amount of stuff that it's really good about this bill. It does spend, Mr. President, $3.5 billion on stuff, and many of those items are very nice items that people are going to benefit by in some way or other. There's a whole bunch of equity, a whole bunch of reaching out to the different minority groups that have been underserved, and there's a whole lot of health disparities, Mr. President, both by geography and by ethnicity, that this is going to begin to make a difference about. There's a bunch of child care in here. If you're a child care person, there's a ton of child care money. The rates are going to be good. Perhaps the industry will be saved. A little bit of stuff in here for some licensed homes. They'll get some benefits and some grants, and hopefully they'll be a little more workable than the past series of grants. Dental coverage, and just a lot of good things in here. And so, Mr. President, I wish the discussion could have been about that instead of this big clinker we had to talk about. And I spoke to that before at some length, and I'm not going to go there. But when you're trying to build an agreement, Mr. President, you know this. There's some things that you know that people kind of like, and there's some things that they could live with, and some things that they're never going to do. And I have learned that in my experience with this topic over the years. There's some things that the people across the aisle are never going to do. Like, I've never tried to cut Planned Parenthood. Never once, Mr. President. When I had the decision process like this, like the leaders did in this bill, never did it. Because you know why, Mr. President? You know why? Because it's a non-starter. Because it just aggravates people, hurts people, it drives their passions and their fears, and sometimes what's at their very core. And it didn't need to be. And as I listened to the debate, a lot of those nice things in this bill didn't even come up because we're so busy bleeding on our side here, because we are so grieving about the future of some of these unborn children, and if they make it to be alive, are they actually going to have a chance to thrive? It's not fake, Mr. President. It's not like your opinion or my opinion. It's like what drives us to our core, drives me to my core. I'll speak for myself only. I have learned, been married long enough, Mr. President, to know, speak for yourself. Thank you. So I'm speaking for myself. And people are watching. I'm surprised how many people are watching this early morning debate and the one now. I get a ton of texts. Just one thing on this topic, and then I'll move on. There's a group called the Abortion Survivors Network, and there's thousands of people in that. Thousands. It's not like there's 2 a year in Minnesota. There are 2 a year that think we should try harder to save, but there's thousands. And those thousands of people are making a difference in their community, and they're alive, and they're part of our people. And I just am sad that, anyway. Would Senator Wiklund yield for a question, Mr. President?
Senator Wiklund, will you yield? She will yield. Senator Abler.
Well, thank you, Mr. President. And the Positive Alternative Program is being restructured at best. And so there's like $7 million a year or so, and I don't remember how many grantees in that program. It's kind of being rolled into a new program. And so my question to Senator Wiklund, are the existing grantees of Positive Alternatives going to be eligible as a priority to the new program if they will agree to the terms.
Senator Wiklund, to the question.
Mr. President, Senator Abler, existing grantees, I think that they will be able to apply. There is a new program, the Healthy Beginnings program that the Department of Health is establishing, which will focus on the early development and helping support pregnancy and infant outcomes. In fact, in the bill, we do have 4 grants going to organizations that are currently using the Positive Alternatives program. Going forward, there will be an application process, and I think that if the entities are eligible, then they will be able to get funding through the Healthy Beginnings program.
Senator Abler.
Oh, wait. Pushing the wrong button. It's already on, Mr. President. I'm technologically amazing. Well, Mr. President, thank you for that answer, Senator Wiklund, and I presume that the department, I don't know if it's Health or Human Services, is listening to us. I'm sure, Mr. President, they are just eager to hear every word we got to say, but if this is one word I hope they listen to, that I hope and I urge you as departments with these grants to find a way to reach out to these entities that have become a part of their communities, a part of helping people's lives thrive, and if they can bear to put up and saying that word that they just cringe inside about, if they can meet the letter of their requirements, I hope that they're allowed to continue. Because I don't believe it's the intent of this body, and we can't question intent, but I'm giving credit for the intent, Mr. President, that any of these worthy programs would suffer and disappear from their statewide placements. So, Mr. President, here we have a bill that spends $3.5 billion. This is the most amount of money that I believe will ever be available in one session to spend. In fact, Mr. President, because almost $700 million is being spent in the last biennium for the Healthcare Access Fund as one-time money, this is carrying forward $700 million into 28-29, which is not recognized in the global agreement, not recognized in the tails. And I have done all I could do to get the MMB and the governor's office. I gave him a note personally, Mr. President, and the fiscal people at DHS and whoever else would listen to me, all the King's horsemen and all the King's men, Mr. President, and women. And I have not been able to have them go like, that could be a problem. But I'm telling you, Mr. President, that will be a problem. And some of these programs we're so excited we're passing today when the November forecast rolls around and the following one and these other out years begin to be recognized, we might be realizing, holy cow. And so the very good we're hoping to do may be diluted. But Mr. President, finally, you're always happy when I say that. It's the final paragraph. There's still a few sentences, Mr. President. But so finally, this bill could have been better. There is not a bill that could not have been improved with more eyes and fingers on it. This could have been improved if all the majority conferees were included, to an extent more than trivial. It could have been improved if both the minority conferees were included. It would have improved markedly if people on the committees in this body who understood these different elements were included. We had a legacy opportunity to spend $3.5 billion and have it stand the test of time and be balanced and reflect the priorities of Minnesota. Instead, Mr. President, everything was treated as a priority. And there are projects, and whoever had a project, you got one in, good for you. But these are all a lot of one-offs. They're not coordinated. The Department of Health lists the things that are added in. They don't even know what departments they're going to put them in. They just program, staff them up. Who's even going to know it's a program? Instead of having a concerted effort, Mr. President, after equity and minority care, health care, and it could have been so much better. I spoke with Commissioner Cunningham privately about this. It needs to be better. In fact, it's just going home as scattershot. So when everything's a priority, Mr. President, nothing's a priority. The legacy programs in this bill, the nursing home, no, not nursing home, the wrong bill, the hospitals and the mental health care could have been so much sounder. So, and I just want to repeat, I was just talking to one of my good colleagues. If that A-word stuff wasn't in here, I'd be telling people to vote yes. Because on the balance, there is way more good There's some challenges, and Senator Utke's concerns are totally true, but I would have been voting yes today, and he would probably still be voting no, which is how we do it here, Mr. President. But members, I'm sorry, I have to urge you to vote no. And can we take a lesson from this, Mr. President, to collaborate more? That's what people want us to do. Thank you very much.
The last voice before we speak is, before we vote, is Senator Wiklund.
Well, thank you. Thank you, Mr. President. Thank you, members, for the discussion today. I really appreciate being able to bring this bill forward. It's the result of a great deal of effort and work and collaboration over the whole session. Despite the words, I think that we have had a very collaborative process in bringing components of the bill forward. We have worked with the administration. We've worked with members to bring their member priorities into this bill, and we took them into conference, and we're able to come out of conference committee with a large number of the member priorities in the bill. I won't go into all of the details, but I just want to say again how I think that this is going to be providing a really transformational way to address healthcare coverage in Minnesota for our youngest Minnesotans. I think that we are also going to be able to recognize that we do have racial disparities in healthcare or health in Minnesota, and we are providing funding for organizations and programs that aim to close that gap. The HHS budget bill, it expands access to health care for Minnesotans, and it invests in rate increases, as I've mentioned, for such things as reproductive health services and mental health services. And just a comment about the mental health rate increase, I did want to point out that while it might sound like 3% is not, we would like to do more than 3%. However, I would like to just make sure people know that it's 3% on the 1st of January of 2024, and then there's an inflation factor that comes into play every year thereafter. We are assuming through the rate structure that there will be an inflation of about 2.7% per year. So the total amount should be increasing over 10% across the whole horizon of the bill. That would actually bring us to a point where we are exceeding what the Senate proposal that we took into the conference committee. So I really think that we are providing a substantial rate increase in the mental health area, and recognize that maybe it's not all we need to do, but we can continue working from here. One area I didn't mention in terms of public health, we do have strong provisions in here that not only are to transform and support local public health, but also we have our programs that will address remediating lead in school and childcare settings. There's a number of new provisions that have to do with, as I mentioned earlier, about overdose prevention. And I'm really impressed with all of the great proposals that we were able to include that support public health in a better way. Another area I didn't mention that I'm very pleased that we were able to fund fully, or almost fully, is the area of IT. And we have, over the years, not been able to keep up with all of the information technology needs in our different Department of Human Services systems. And so I'm really glad that this budget, we are able to address key projects that the department brought forward in funding them at around 80 to 90% of what they had originally come forward with. So again, we are addressing health and human services, we are addressing children and families, and I really would urge you to provide your support today and a green vote. Thank you very much.
Members, the Secretary will take the roll on final passage for Senate File 2995 as amended by the Conference Committee. Members, please vote. Members, we're going to have to reset the board. I'm sorry. Hold on one moment. Okay, members, it's okay to vote. I'm sorry. You can vote now on the final passage of Senate File 2995 as amended by the Conference Committee. Senator Bowden, for those voting under Rule 40.7.
Thank you, Mr. President. I report that Senator Mann votes aye.
Senator Mann votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Zhang votes aye.
Senator Zhang votes aye.
And Senator McEwen votes aye.
And Senator McEwen votes aye. Senator Rasmussen, for those voting under Rule 40.7.
Thank you, Mr. President. Senator Barr votes no.
Senator Barr votes no. Members, please vote. All senators having voted who desires to vote, the secretary will close the roll. There being 34 ayes and 32 noes, the bill is passed and its title agreed to. Members, we're just getting something situated for the next conference committee report, so give us just 2 minutes.
If you're going to be late like that, I'm going to start thinking I should. All right. Excuse me.
Did you get, okay, 1, 2, 3.
That's all, isn't it?
Okay.
Did you get Wiklund's?
I got Wiklund's, Gene 6.
I need a copy of both of those for Mike.
Hey, Sam, need 1 copy.
Need a mic?
What? Up here.
Can I get
It'll be up to you guys. Sam, need 1 copy up for Scott.
I will need a mic.
You need 1 more of that one.
You need a packet. Mike needs a packet. It's Tom need a packet.
Say, do they start to beep if they need to get plugged in?
No, they don't need to be plugged in. They're battery operated. So we're going to replace. They can be plugged in, but I think that's more if we had microphone stands. So, yeah, no, they're still good though. Like that's the battery. Bobby Joe Champion has one, and there should be 1 more somewhere floating around.
Members, remaining under the order.
Gotta hold off.
Senator Dzik, use that microphone. Just don't do any karaoke. Senator Dzik.
Yeah, I'm not going to do any karaoke. I can guarantee that. Thank you, Mr. President. We
I think there's some still issue we're waiting for in the revisor bill, and then we are waiting for the bonding bills. So, Mr. President, I ask for a recess to the call of the president. I'll keep Senator Johnson in the loop, but we're going to start with at least an hour. Thank you, Mr. President.
Thank you. Any questions on that motion? Seeing none, all in favor say aye. Aye. All opposed say no. The motion prevails. The Senate is now in recess until the call of the president.